Hi everybody, my name is Emma Smalley. Today I will be demonstrating how to properly draw blood from a dog. I'm a veterinary assistant, so I do this pretty often at work, so please do not try this at home with your own pets. But today we just have my stuffed Scooby-Doo that we're going to use, and then I just have a small 1 ml syringe. It doesn't have a needle or anything on it, but just for pretend today. First things first is you want to make sure you know and determine how much blood is needed. That will help you determine which vein is the best option to use. So if we need a larger amount of blood collected, we can use the jugular vein, which is the typical one we use. So there's going to be one along either side of the neck. They are larger vessels, so they can output a larger amount of blood easier. The other vein we typically use is the cephalic vein. So it's going to be along the inside of the arm, on both arms. That's the one I will be demonstrating from today. It's a smaller vessel, easier for smaller amounts of blood. Once you know which vein you're using, you're going to make sure you have your coworker or restrainer restraining properly. I'm just going to show you that really quick. You can have the animal laying down or sitting. This animal is already positioned laying down, so I'm going to keep him like that. But they're going to kind of go ahead and give them a big hug, just making sure they have control of their head to pull it away from the person performing the procedure. And then they are going to place their hand where the elbow is and push it out so the arm is straight, and then place their thumb on the inside of the arm where the vein is, apply pressure, roll the vein forward, and occlude the vessel. So applying the pressure will help to occlude the vessel, and that will help to pop the vein out more so the person performing the procedure can see it easier. And then rolling it forward as well will place the vein right on top of the arm so that the person can access it easier as well. From there, once you have them restraining properly, I'm going to put you guys right here so you can kind of see the actual process of drawing the blood. So from there, you're going to make sure you can locate the vein itself. So if you can't see it or feel it on its own, we can spray rubbing alcohol to kind of separate the hair to see the skin easier. We can also shave the area if needed. Normally rubbing alcohol does the trick, and we don't always need to shave. So just making sure you can see it or feel it at least, or both. From there, you're going to make sure you have your syringe and it's ready. You're going to insert the needle bevel up and insert it right into the vein. And then once you're in, you're gonna go ahead and pull back, collecting your sample. Once you have collected your sample, you are gonna place your thumb or your finger over the top where the needle was inserted and just apply pressure, pull that needle out. The restrainer should be able to take over holding pressure on the vein so that the blood can clot and there's no risk of bleeding out or anything for the pet. From there, the person that did the procedure can go ahead and take their sample, place it into blood tubes or whatever is needed. You want to do this pretty quickly with the transfer, just because the blood can clot really easily in the tube if not transferred pretty fast and inverted in the tube. From there, after a few seconds has passed, the restrainer can take their hand off the vessel and we can kind of see how it looks. If it's bruised, if there's a small hematoma, we can go ahead and place a pressure bandage drop on that. Just to make sure, which is like how humans draw blood when they put the little bandage on your arm. Same thing, same thought process, just to make sure we can get that hematoma down and any bruising so it doesn't cause any further problems. That normally can come off about 10 minutes after. But yeah, that's it.